Now, how to diagnose synovial chondromatosis and by ruling out other differentials. First and foremost, whenever we have a joint involved, we get X-rays. If it's knee joint, we get AP and lateral view. Mostly, it's always called as weight-bearing views. If it's hip joint, we can get AP lateral and sometimes orthogonal views as well. If it's elbow, sometimes we have to get AP and lateral along with the radiocapitular view as well. But again, mostly minimum two views is important, and two views are needed to actually exactly assess what is wrong with the joint. When we get X-rays, first and foremost which are ordered, and when you get an X-ray, this is what the picture you see. If you can appreciate, this is a lateral view of an elbow joint, and you can appreciate multiple small cartilaginous bodies which may sometimes look like it's maybe bone, maybe cartilage. They look like they're in the joint and they're around the joint as well. Therefore, what is important is that by just looking at the X-ray, it's very difficult to actually view that you can exactly say whether this lesion is around the joint, protruding and involving the joint, or just inside the joint as well. But if you see, sometimes we have to go for other investigations as well. And from X-ray, we go towards the MRI and CT of a joint. If you appreciate, this is a CT over here of a synovial chondromatosis, you can appreciate this is the lesion mainly lying in the inferior medial aspect. Now, this sort of a thing, if it would have been lying slightly more further apart inside the muscle, then it would be difficult to actually call it synovial chondromatosis. And the first thing which would be coming to your mind would be myositis ossificans. Therefore, once we have done our X-rays, we move to another investigation, that is the MRI. And when we get an MRI, why we need to get an MRI? Because we need to rule out how much is the hypertrophy of the synovium, what is the situation of synovial fluid, how much actually is thickening of the synovium has taken place, and is there any other problem with the soft tissue structures or not. When we get an MRI, now picture could be again vary. Now this is also an MRI of synovial chondromatosis showing small lesion outside the joint which is not really communicating into the joint, and you can appreciate intra-articularly this is all okay. Now to differentiate this from osteochondral discecans becomes difficult. Again, synovial chondromatosis may present like this, that the lesion is in the joint over here as well as outside the joint, but there is a large bursae swelling in the posterior aspect of the knee. This may be due to the inflammation as well, or it may mimic like or may present like this as multiple cartilaginous lesion in the posterior aspect, intra-articularly, inferiorly, superiorly, as well as on the anterior aspect of it. So as synovial chondromatosis presentation may also vary a bit as well, but we have to get an X-ray, then we have to get MRI, as well as sometimes we have to go for the CT as well. And if we get a CT of the hip joint, this is what we see. There are multiple lesions over here which may are present around the joint as well as maybe involving the joint as well. So what is the first and foremost thing? Because in our differentials, we were skipping certain sinister things like chondrosarcoma, osteosarcoma. Therefore, if this is associated with history of weight loss, increased pain, large swelling, mass-like lesion, then probably first and foremost we'll have to go for a biopsy to rule out these malignant conditions, and then go for any sort of a treatment of synovial chondromatosis. And why we need biopsy? Because on if we get a biopsy, what would we see? We would, on histology, we would see this sort of a picture. You can appreciate there would be clusters of cartilaginous cells with a variable ATP. Most of the cells would have multiple nuclei, and usually they have a binucleate. There are clusters of cells with cartilaginous matrix. As it is chondromatosis, it's involving the chondroid matrix, so there is a lot of cartilaginous material, cartilaginous cells which can be seen on the histology. But To make your confirm our diagnosis after history examination, first and foremost, we have to go for X-rays. Then we have to go for CT and MRI. But if we on MRI or on CT, we see any suspicion of soft tissue involvement or involvement of bone beyond the joint or borders of the joint or more, then we have to be suspicious of underlying tumor, and we may have to go for biopsy first before going for any type of surgery. And on biopsy, what we see is if these clusters of cells with variable atypia with showing a chondroid matrix problem, and this is mainly the cartilage which can be seen on the histology.